So today we're going to go over some of the different things that you might see or set up for a crown and bridge procedure, whether it's a start for the preparation or an insert. These are just some of the instruments and just some ideas to help you streamline the whole process. So basically, if we're doing a preparation, we want to make sure we have everything out because we know how tedious and time consuming it is during a preparation, and if we have to leave the room and come back and kind of set things off course there. So, of course, one of the first things we want to do is we have our anesthetic, patient's going to get numb. We want to take a shade right away. So our Vita shade guide, grab that shade right away. Very important, because if you wait until later on in the procedure, by then the teeth become dehydrated because the mouth is open, and it can actually affect your shade. So pick a shade right away, natural lighting. That's going to give you your most accurate shade. So, of course, once we go to start the process, we have our diamond burrs for the preparation. But another thing we want to do right out of the gate, we pick our shade, is we want to take a nice Blue Bite impression. Blue Bite's great. It holds up throughout the course of a couple weeks while we're waiting for that permanent crown to come back. So if for some reason the tooth is broken, I like to add wax to build it up, but Blue Bite's great as well, because even if you don't use wax, you can essentially cut the area out and form a tooth. So do that ahead of time prior to the end of the procedure, then you'll save yourself some time there. So some of the other things that we have out, we have our impression guns with our heavy and light body in the event that we're doing an impression. I know we've gone to a digital age, so if you do find yourself doing scanning, that's obviously not necessary. But once we get started, some of the instruments that we would use, of course, I like to keep 2 mirrors on the tray at all times. So my setups always have 2 mirrors, especially for mandibular retraction for the assistant. So Doc has a mirror, Explorer, assistant has a mirror on their side. Also, all my kits I put together, I have 2 college pliers. One for Doc, one for me, because chances are Docs always get contaminated. So mine are always clean in the event that I need to grab things, which of course during a crown and bridge, you might be reaching for college pliers, cotton rolls, gauze, things of that nature. So that's something that I'm always reaching for. So once we get started with the procedure, tooth is prepared, obviously. We have our diamond burrs, which I mentioned earlier. In the event that we have to place a core, I also have that stuff ready as well. So we have our etch. You can get some bond. Core material, I know some doctors just use composite, but there is core material out there, so that depends on your doctor. Core's been placed. So now you might be tasked to cut the cord. So cut the cord, pack the cord. If that falls on you as the assistant or EFTA, of course, I have a couple of different cord packers here. I actually prefer this packer, but then there's a flat end. So that depends on your preference, doctor preference. Also, you want to make sure that you're even allowed to pack cord. Some states don't allow dental assistants to pack cord because if you think about it, that gingival retraction, you can do damage, and that some states have laws that protect the patient against anything that an assistant can do that can cause harm. So don't just dive into cord packing. Make sure you're checking that danb.org for your allowable duties. So, but if you are packing cord, consult with your dentist, what size cord to use. Sometimes you might pack 1 cord, 2 cord, whatever it is. Make sure you check. I just did a video on tips and tricks on cord cutting. Actually, I still have the gloves on here. So if you are in need of trying to figure out cord, molar, here's a good guideline. You wrap the cord right around the pointer finger, right below the joint. So molar. And then we have our bicuspid premolar right below the ring. And then the tip of the pinky for those incisors, so your central lateral right around there. So that's just a quick guide. So wrap the cord around, cut, but feel free to look for the other video. I did more in depth about cord cutting. So If you do pack the cord, then at that point, I also love these. One of the doctors I used to work with introduced me to these hemostatic cotton pellets. Love these as well. And then, of course, in the event of after you pack your cord, comfort caps. Another great thing. Put this on the tooth. Give it a couple minutes for that to calm down. Then, of course, once you go in, remove your cord. Then we're going to take our impression or scan. Now, if we're doing the impression, we use that heavy and light body, so you can see the light body had shown up here first. Then we loaded the tray with the heavy body. Then after the impression's done, we pull it. Then we would start our temporary impression. So that's what's great about the initial impression we had taken, so then we can replace it with what the tooth initially looked like. Now, you do your scan, same thing, scan's done, doctor checks that everything's good, you can send it off to the lab. Then, of course, you can start your temporary crown. So other than that, that's just a quick overview of what we have going on here. In the event that you're actually cutting off an existing crown, I have a couple instruments here. This is a crown Nemetz. This is great because it helps reduce the chance of the tooth breaking. In the past, I've worked with dentists who grab an elevator. Next thing you know, they fracture the roots. But speaking of elevators, there's also these instruments. These are crown splitters as well. Very comparable to elevators in the design, but obviously some things have changed. So when your patient comes back for your permanent crown, then you can pop that temporary off, and now we're just going to go ahead and cement the permanent on. So once again, check your state laws. Make sure if you are making temporaries, packing cord, cementing crowns, make sure that you are allowed to do so. A lot of dental assistants don't realize the allowable duties that they are and aren't allowed to do. So please let me know if you have any other questions. I hope that this quick guideline over crown impressions helped you out. Oh, and in case if you've never seen this before, that's like dead center. You might be thinking, what is that? So this is actually a crown bumper. And what this does is if somebody comes in with a crown that's already cemented on that you have to redo, you would put this under the crown, under the margin, and you would, very medieval looking instrument, but it's very effective. The force of that will knock off the crown, bump it. So hopefully that answered all your questions. I'm looking around here, seeing if there's anything that I missed. We have our isolation materials here, but please feel free to contact me if you have any questions about this procedure or maybe another procedure that you would like to see, and we'll do our best to put that material together for you. You can always email us at cornerstonedainstructors@gmail.com. Of course, don't forget to follow, subscribe, and like our stuff on TikTok, Instagram, YouTube, Facebook, etc. And thanks for your support.